Voilà, quand nous de deuxième temps, nous arrivons là pour nous passer dans notre topic conversation. Et aujourd'hui, bon matin, pareil, moi, tiens, promet tout plus bonheur. Aujourd'hui, nous pouvons faire conversation le côté médical. Et pas nouveau, le bonjour Cécile, ça, docteur, une des avenues auparavant, une cause les autres topics. Mais aujourd'hui, il faut adresser un sujet qui m'a quoi, beaucoup de bonnes madame, nous capables de gagner un peu plus d'informations pour créer par nous dit éduque-nous le bon différents symptômes sa problème médical et aujourd'hui bon matin nous pour cause un petit peu le PCOS mais aussi le côté obésité qui m'aille au très lié camarade et où ça madame qui peut-être là on arrive dans ou bon middle age par nous dit si moi une bonne différents changements qui peuvent arriver avec nous les corps. Et aujourd'hui, nous proposons avec le docteur pour nous comprendre un petit peu sa bonne situation. Et si on a aucune question, pareil, nous encourageons dès 88 89 89 et numéro qu'on capable de texte nous, WhatsApp nous pour participer dans nos conversations aujourd'hui bon matin. Là voilà, dès 88 89 89 c'est le numéro qu'on s'est posé fini save dans le téléphone. Pour aujourd'hui bon matin, on a grand plaisir encore une fois pour introduire autres avec Dr. Sunganya. Good morning, how are you, doctor?
Bonjour.
Bonjour.
Bon bien, merci.
Mon remarqué, on peut pas mal débrouiller, on créole peut improve. Tout le temps, tu retournes Cécile, hein?
Yeah, mon peut apprendre créole.
Well done, doctor. For today, we can give you a 10.
Yes.
So, doctor, before we go into, of course, our topic for the day, I start my conversation by asking, now, how do you start your morning? Tea, coffee, water, and what time does Dr. Sunganya wake up?
I wake up at 5 a.m. in the morning.
Every day?
Every day.
Monday to Sunday, doctor?
Monday to Sunday.
Ooh,
very
all right.
particular about this disciplined waking
Yes.
up at early in the morning.
All right.
Having a full glass of water.
Yes.
And then I exercise regularly.
Okay.
Meditate and
Yes.
then continue my day.
All right. That's the way you start. You have a preference for breakfast in the morning?
Yes, I do.
Yes.
Breakfast is, as the name says, breaking the fast.
Yes.
So the overnight fast is broken,
Yes.
and when you eat healthy, you stay energetic for the rest of the day.
What are some of the things we can see on your breakfast plate in the
Okay,
morning?
the plate is a mix of, egg whites,
Yes.
that's protein,
Yes.
and some carbs.
Yes.
That can be in Indian food that we have idli.
Yes.
That is a very nice carb, equal balance.
Yes.
And then I go with a glass of milk. And no coffee, no tea.
No coffee, no tea?
No tea.
Do you have any coffee or tea during the day?
No, because these caffeine and theanine
Yes.
are not so very good for your health.
Yes.
So I always go with some water with some lemon juice,
Yes.
and that makes my day throughout to be energetic.
So we're just having water throughout the day?
Yes, 3 liters of water compulsory daily.
All right. However, we must say, from where you're from, the tea is very nice, doctor. I'm
Yes.
surprised well, not surprised, but I admire your discipline on resisting the temptations.
Yes,
All
thank
right.
you.
So, doctor, this morning we're going to talk about something very important, especially to us ladies.
Yes.
PCOS, if I'm getting it right, PCOS.
Yes, you're
Now,
right.
if we can start with the conversation about what does it mean? What is it exactly?
Okay, the word PCOS
Yes.
is Polycystic Ovarian Syndrome. That is
Okay.
the full form.
Yes.
The whole part is to deal with the ovaries.
Okay.
The ovaries develop small cyst.
Yes.
It is not to be something very worried about. They are tiny. They are very tiny, 1 millimeter or 2 millimeter to the max.
Yes.
And they corner around the ovary like a necklace.
Okay.
So the main part is because it happens through the hormonal imbalance.
Yes.
The eggs do not get released every month.
Oh.
So that is the main issue to be addressed. So this is an entire hormonal change.
Yes.
That shifts from a woman from being an ovulatory woman to an ovulatory woman and ending up in infertility.
Is there a specific age that we can see this, that it starts happening in us women?
The PCOS can happen anytime after puberty.
Oh,
Any
okay.
girl who had attained menarche,
Yes.
they can show up symptoms of PCOS,
Okay.
and as late even up to the age of 45 years.
Okay.
And this causes huge hormonal shift, and the imbalance is so high, so the woman is not able to whole the difference of hormonal
Yes.
pattern she goes through.
Okay.
So maintaining a menstrual calendar is very important.
Yes. And of course, with this condition, does it help the menstrual calendar or just throw it in disarray? It's all over the place.
Now, it is like the menstrual calendar. As a gynae,
Yes.
it helps me understand the pattern
Yes.
because the PCOS does not show up a specific pattern.
That's what I'm asking.
Yeah, it can go up in some, or
Yeah.
it can go a plateau in some, or it can go as low in some. So, studying the menstrual calendar
Yeah.
for a minimum of 3 to 6 months helps the gynae to understand the hormonal pattern and treat accordingly.
What are some of the symptoms of this condition?
The condition actually begins with irregular menstrual period.
Okay.
The woman or the girl can experience her cycles
Yeah.
to become very irregular.
Okay.
Speaking of irregular, we need to know what is regular.
Yeah.
Regular is having the menstrual period every month.
Okay.
And it can happen anywhere between 25 to 35 days.
Okay.
All right.
And if it's above that?
Above that, it's considered to be irregular, or
Okay.
if it's occurring less than 25 days, again it is irregular.
All right.
A girl can menstruate only once a month,
Okay.
and the duration has to be somewhere between 3 to 5 days, and it can be accepted up to 7 days, but when it is more than 7 days, it's an alarm sign.
We should come to the doctor.
Of course.
We should definitely come to Dr. Sunganya if your menstrual is irregular, ladies and gentlemen, mesdames et messieurs. But I like to include the guys because the guys should be as informative of the situation in order to understand their ladies. Because
Yes.
when we talk about hormones, correct me if I'm wrong, doctor, a lot of the times we say, oh, you know, her mood swings is based on her hormones imbalance. How true or how untrue is that?
All right. It's very true.
It's true.
It's very true.
So the guys are very happy right now that you've said that.
Okay, coming to this part, it is very informative.
Yes.
Because the female sexual functioning activity has got a scale
Yes.
that has got to depend with the desire, sexual desire, her peak of orgasm, the lubrication part,
Okay.
and the desire to have sex itself is affected by this hormonal pattern.
Okay.
She goes huge mood swings.
Yeah.
She becomes very irritated, vagina is very dry, and it makes the sexual pattern for the lady or the woman become very painful.
Uncomfortable, isn't it?
Uncomfortable.
Yeah.
And the partner has to be aware that his partner is going through some hormonal changes
Yeah.
and needs to be corrected immediately.
And can it be corrected immediately, doctor, through medical treatments?
Yes, when
Okay.
it comes to correction part, first the gynae has to assess certain things.
Okay.
Say like what is her body weight and what is her hormonal levels,
Yes.
and how can we divide her into the treatment, because the whole treatment, it depends upon her body weight.
Yeah.
That is the key factor here.
Okay.
The more the body weight is, the difficult the treatment is going to be, because the obese women become more susceptible to the hyperinsulinemia. This is a whole term we use.
Yeah.
But in general, the body secretes a lot of insulin. You know, the insulin is a hormone that is secreted to control the sugar.
Yeah.
So whatever we eat, it's get converted into sugar, broken
Yes.
down into glucose.
Okay.
And that is the energy for every cell.
Okay.
When the obese women eat and this glucose is in so much, then the insulin is so high, the body stops responding. So
Okay.
the fat or the obese woman is very difficult unless they cooperate with the treatment pattern.
So that can also, I hear insulin, I hear sugar,
Yes.
diabetics.
Yes.
It fits in there somewhere, doesn't it? It's coming.
Yes. In PCOS,
Yes.
the woman is susceptible to become a diabetic
Okay.
in 5 years or 10 years period.
Okay.
She will throw up diabetes if not treated at the earliest.
Okay. Now that we've talked about this, let's go back to the PCOS.
Yes.
What are some of the treatments available for
All right.
this?
The treatment for PCOS
Yes.
begins with the patient,
Okay.
because it begins from what she takes inside her mouth,
Okay.
what she puts inside her body.
Yes.
Because their diet. The very word diet causes stress to the women.
Okay.
I am dieting, I am not eating anything. Many of my patients come and tell, I eat very little, but yet I am not losing any weight.
Okay.
See, the key factor here is the balanced diet she has to take.
Okay.
And she has to take her breakfast every day, not fasting until mid-afternoon,
Yes.
and then having a lunch that is comprising mainly of the junk foods, then it is not going to help.
Yeah.
Coming to the diet which I am explaining, we will put it in this way. Let's speak about disciplined eating.
Discipline, like doctor doesn't have coffee or tea in the morning.
Exactly.
That kind of discipline.
Drink a glass of water
Yes.
the moment you get up from the bed.
Yes.
After brushing your teeth and doing your daily routine, take a huge glass of water.
Yeah.
It neutralizes all the toxins in the body
Okay.
and washes away all the toxins, whatever we have stored overnight.
All right.
The negative toxins, the stress factors, everything gets washed with a simple glass of water.
And that's the perfect start of the day.
That's the perfect. It energizes every cell of your body, keeps your cell very hydrated, your skin glows, you look young, the skin is hydrated because of a single glass of water changes a huge shift in her entire body. Followed by a simple exercise routine that has to be followed regularly.
Yeah.
See, we can arrange exercises, we can think of gym, we can think of swimming, we can think what not, but what fits a person,
Yeah.
what can make her become it as a daily routine,
Yeah.
only differs from person to person.
Yeah.
Only she knows what she can do at regular basis. Start with a very small goal
Yeah.
of exercising regularly for 30 minutes a day, be it a simple walking or a jogging,
Yeah.
and then the body releases all the negative toxins, and then the hormone shift starts from there.
I've got some interaction from the members of the public, and I've got a lady who's asking, can these conditions affect my chances of having a baby?
Yes, of course.
Okay.
Because, as I said, these are small cysts and doesn't allow the eggs to hatch and come out and cause ovulation.
Yes.
It blocks like a necklace around the ovary. So, it definitely affects her chance of becoming pregnant, and the chance, and it increases the risk of miscarriage as well.
Yes.
So, it has to be treated as early as possible if the lady is planning for pregnancy.
Okay. And are there chances where the cyst is so badly
Yes.
affecting the ovaries that we have to remove the ovaries, doctor?
Yes, not really. The extreme chances the eggs start secreting some chocolate colored fluid.
Okay.
Like we have a period,
Yes.
the blood gets released inside the eggs, the
Okay.
small cyst.
Within
And
the ovary?
Yes, within the ovary.
Okay.
That is the last stage of the PCOS.
That's when the worst case scenario is where
That's
we
the
call.
worst case scenario.
Okay.
And that is called as the endometriosis, and that is also known as the chocolate cyst.
Okay.
And when the chocolate cyst has arisen, then it is mandatory to knock off the cyst and preserve whatever ovary is left behind,
Okay.
because fertility is always under the concern. So I advise all the women to come early for the treatment.
And I've seen someone asking, do your services extend to free egg freezing as well, in case, for example, we've seen patients have gone through the treatment and it's still not working, and we don't wish that for anyone. But if it does happen, do sexual women have the opportunities to freeze their eggs
All right.
and perhaps save it for the
Later.
future?
Yes, that's very nice question.
Yes.
Egg freezing is a separate entity.
Okay.
And egg freezing is done where the IVF is considered. So, for the eggs to freeze, we need to grow good quality eggs.
Okay.
The quality of the eggs matter.
Yeah.
And still, yes, we can freeze the eggs and save it later if the woman has got issues having in the uterus or some ovary that needs to get corrected
Yeah.
first and then plan the pregnancy.
And that can be done in Seychelles, doctor, just to clarify, or would this necessity be that the patient has to leave the country?
I'm not sure the service is here. I think she has to leave the country.
She has to leave the country. All right. So this is something that you can discuss with Dr. Sunganya when you see her on your visit. And next question is coming in. Hi, Sylvie. Please ask doctor the following. I've removed my uterus because of fibroid 2 years ago. I've moved from 83 kg to 88 kg, feeling joint pain sometimes, very bad. Is there any remedy? Now,
All right.
a little bit about this, doctor?
Yes. See, the person is worried about her weight.
Yes.
All right. And removing the uterus has got nothing to do with her weight.
Okay.
It is simple because the diet, as I say, the disciplined eating and exercise matters and helps her in losing weight. There is no special magical pill that will bring her the weight down. And
Okay.
if she has excess joint pain, that is the first indicator the body says to ourselves. The body cannot bear the weight what she is carrying through. So it is important for her to reduce her weight by disciplined eating and exercise. If she needs further help, she can contact me because we correct it by laparoscopy.
Yes.
The weight, excess weight.
Okay. Now let's talk a little bit about that. I like how you brought that in. When does a lady know that this, what are the specifics that caters for that kind of service?
All right.
That kind of medical treatment?
When the body mass index, you
Yes.
know, BMI,
Yes.
the height into weight ratio
Okay.
is more than 35 or
Okay.
32, it is an alarm for her to take up the treatment.
Okay.
This we do it by laparoscopy, where we put a small camera. And you know, laparoscopy is done by inserting a very small camera.
Yeah.
It is also known as minimal access surgery, where a small scars like that of a little finger is made over her abdomen. And through that, we pass the camera and then proceed with a bariatric surgery. This is also known as sleeve gastrectomy, where her portion of the stomach, it is whichever that is in excess,
Yes.
it is cut down and bring down to her normal height, which is average for her body.
So we're reducing the size of the stomach.
Yes.
All right.
And then when the stomach size is reduced, she will be able to consume whatever it is compatible for her height and for her weight. We calculate the body mass index and the portion of the stomach that is needed for her.
But that, doctor, in itself, we can reduce the stomach. But I like how you've said discipline, because you can reduce the stomach, but if the person is not disciplined enough to watch the diet, we go
Yes.
back to the same problem, doesn't it?
And now, with the bariatric procedure,
Yeah.
with the laparoscopic correction, after the correction, it is impossible for her to go back to the same weight because the stomach size portion is contained.
Yes.
So, whatever she will be eating, she will be informed about the nutritious, healthy diet which she has to follow throughout her lifetime. And having gone through a procedure, I know for sure we all are aware that we need to follow what we are supposed to have in our diet.
Now, let's go worst case scenario. Should that person not be disciplined enough and falls off the wagon during that process? What are some of the conditions that can occur? Because we want them to understand that a lot of people take this for granted. They come in and they say, oh, we want to do this. We want to reduce the size because it's the trend and we want to just lose weight and make it easier for us. But the discipline that comes with it is very, very important equally as well. Now, should somebody fall off the wagon and not be able to maintain that discipline, what are some of the worst case scenarios that can happen after laparoscopy?
Okay, after the procedure, the worst case scenario, if the woman is still tempted to have the junk foods or her liking, then that won't fit her body because she will throw up, and once she starts throwing up and then she feels like not eating at all, then she loses all her nutrition in her body and loss of hair, she becomes very weak. This is one side, one scale. The other scale, yes, as you mentioned, there are chances for her to go back to her, not the original size, but still on the rounded plump figure she had.
What impact does that have on the inside? I know the outside we will look plump again.
Yes.
Yeah, we gain the weight again.
Yes.
But what happens on the inside where we can't see, doctor?
The inside portion, again, it
Especially the
affects-
stomach, which has been half removed. Does it
stomach is one organ that is very friendly to our human beings.
Okay.
Okay, so it doesn't react much. What we are more concerned is about the pancreas,
Okay.
because that is the key organ inside that secretes the insulin, keeps the glucose under check.
Yes.
It is the check factor there, and every time she eats over, then the pancreas is stressed. She eats under, again the pancreas is stressed. So the disciplined eating has to be carried throughout her lifetime.
I have somebody who asked a question. Hi, Sylvie. Ask Doctor, what about alcohol consumption after this stomach reduction?
I say, in general, we know alcohol is dangerous and
Yes.
injurious to health. And normally, I recommend not to have alcohol, because this alcohol again plays with the pancreas, which we never know, because the alcohol has got this complex compound that has to be broken down. That the effort is excess on the gallbladder.
Yeah.
So the gallbladder is stressed with releasing the hormones that are not recommended for the body. So when the gallbladder secretes so much to break down this compound, it makes her stomach weak, and the gallbladder starts to form stones and infection. So alcohol is a strict no-no after the surgery. Even before the surgery, I recommend.
And after the surgery?
After the surgery, a strict no. And any woman for that matter,
Yes.
minimize your alcohol intake.
All right, doctor, we continue our conversation this morning. If a patient has a PCOS, what medical problems are you at risk for? I mean, we talked about diabetics. What are some of the other?
Yeah, she can have high blood pressure.
Okay.
She can have diabetes, as you said, and she can have a cardiovascular problem later on in her life, because this is a huge metabolic syndrome. It doesn't contain itself to the ovaries. The overall hormonal pattern is changed. So from head to foot, she can show any changes. And last but not the least, she can grow hairs on her face, and here excess hair growth, and that is going to make her a social stigma. It becomes a social stigma. Waxing, removing hair, everything, and above all, she can even develop stroke.
Okay, so these are some of the conditions associated with this condition. Now, an interesting question: can IVF or ISCI, yes, help a woman with PCOS get pregnant?
Definitely. Before concluding that IVF is the treatment, I always say evaluate the hormones, correct it by laparoscopy, and if laparoscopic correction doesn't work, then we go for the big word, because the laparoscopy, what we generally do is we remove the cyst. We do the drilling process. Drilling is a technique where we puncture the cyst and allow the healthy ovary to release the fresh eggs. And believe me, here in Seychelles, I have done laparoscopic correction of PCOS, and my patients are pregnant. I have 8 in a row now.
Oh, wow. Well, there you go. Just to reiterate again, I have somebody asking again, maybe she's just joined the conversation. Good morning. Can you ask her if the hormone imbalance affect us from getting pregnant? I mean, you've answered this question, but just to reiterate for those who've just joined us this morning.
Yes, hormonal imbalance can definitely affect the pregnancy, because you need 2 hormones basically. One is your estrogen, other is your progesterone. In PCOS, the progesterone level is low because there is excess LH level, because that is dangerous, that releases the toxins or the negative hormones that doesn't allow the baby to grow. So it doesn't make the environment of the uterus to be very comfortable to receive the baby. So no eggs are hatched in the first place. If at all the eggs are hatched, when it comes down to the uterus, the environment is very strange inside for the baby to grow. It ends up in miscarriage. So it is always advisable to reach the gynae.
Okay, all right. And you'll be here, doctor, until when?
Until Saturday.
Until Saturday.
And I come every month. The last of every month, I'm here every month.
All right.
À Dr. Mourtis.
À Dr. Mourtis, and of course, par inutilement très plus bonnet dans advert, ou capable call et mettre au apprêtement, et voilà, que tu as un sens pour voir docteur et cause un petit peu la situation. La voilà, différentes qualités check-ups qu'on est capable de faire à travers une session qu'ils ont fait. Doctor, now let's go back to one condition you talked about, endometriosis.
Yes.
How, because I've seen some ladies really suffer from that condition. I mean, the pain that is associated with this condition is, we can't even begin to describe. Now, are there treatments for our sisters with this condition?
All right. The very word endometriosis
Yes.
is very alarming to the women because it is not contained only to the ovary.
Okay.
It affects her tubes, it affects her uterus as
Okay.
well. It is a huge phenomena happening inside her.
Okay.
It has got various grades, grade 1, grade 2, grade 3, grade 4.
Yeah.
And all these grades are leave it to us because we are gynae, we are professionals, we know. What the woman goes is severe pelvic pain during her periods,
Yes.
during her sexual activity, and normal exercise even. When she lifts or bends and lifts up, there is a sharp shooting pain in her lower abdomen. That is what the women undergoes, and this is very, very important to treat because every month when she tries to menstruate, there is some amount of blood that goes under the reversal, goes not from below leakage, it goes as a reversal flow and affects the tubes and the ovaries and end up in the chocolate cyst, which I told you.
Ooh, well, and that is where the pain comes from.
That is where the pain comes from, and it is very severe. You can't imagine. She has a pelvic pain typical on the lower abdomen, radiating to her back and even to the thighs. She can't stand for a long time.
Numbness in the legs.
Numbness, yes. And you can see the women holding her lower abdomen, and the normal painkillers won't relieve her of the pain.
Okay.
The exact treatment which is required is attending a gynae who then we do the diagnosis by a combination of ultrasonography and hormonal analysis and decide what is required for her, the medical management or the surgical correction.
Okay, so there are the options available.
Yes.
Now, we've talked about these conditions, we've talked about the pain level for that, but we also know that there are certain other conditions that comes with this. For example, I've had somebody ask me about skin conditions. You know,
Acne?
yes?
Yes.
Yes, I'll let you take over, doctor.
All right. The skin condition is the acne,
Yes.
the excess flare of acne. Usually the skin is very normal.
Yeah.
It is not prone to acne. People wrongly mistake that acne is because of no maintenance of the skin. They don't wash their face. But people with PCOS have got very high bad male hormone, the androgen.
Okay.
So the androgen makes the skin very rough and all the pores open up, and it is more prone for the acne, and this acne is usually resistant to the medical management.
Okay.
So when a person with irregular cycles, excess weight,
Yes.
and poor sexual drive,
Yeah.
and with acne presence, it's time for her to get it corrected by laparoscopy or the treatment which is recommended by the gynae. The hormonal pattern which has changed has to be neutralized.
There you go. Ladies and gentlemen, mesdames et messieurs, aujourd'hui bon matin, nous pécons avec Dr. Sunganya qui peut, of course, donner un petit peu l'explication de sa situation PCOS et, of course, aujourd'hui, et samedi, il pour là, que Dr. Moti, qu'on est capable de gagner sens pour lui voir où il y a différents tests qu'il est capable de faire et où si on a des gens qui sont aujourd'hui une conversation, il est un petit peu pour une situation qui on a, ou capable, of course, visiter, gagner appointement, et ou capable ça numéro 4 22 42 90 4 22 42 90 ou sinon D 52 14 90 D 52 14 90 et voilà côté capable gagner sens voir où et faire l'examination qui va aider pour diagnose et of course gagner un traitement. Now how fast does the treatment work for these situations, especially the PCOS? Oh, this word is killing me this morning. PCOS. Yes, doctor.
All right.
How fast can a patient be seeing the changes?
Okay. The person can start to see her changes from the very next cycle if it is corrected by laparoscopy.
Okay.
if it is needed the medical management, if she opts for the medical management, then the changes can be seen after 6 months, because an average of 3 to 6 months is required by the gynae to treat her completely. So, the time frame of 3 to 6 months is needed. After 6 months, if she is still not responding, then addition of 3 months is also put in. So, a total time frame of 6 to 9 months for medical management, and by laparoscopy, you can see the results from the very next cycle.
Well, there you go. But of course, we leave the surgery for
yes,
the
for
later
reserved
stage.
for the persons who don't respond to the medical management.
All right. Ladies and gentlemen, mesdames et messieurs, m'apparaît indi ou capable faire li est possible. Of course, we do have one question coming in that says, hold on a minute. Excusez. Good morning, 8 years and still trying. I have reached to the stage of IVF. So now for the IVF, how long is the process duration? And if overseas, how many days after the procedure you need before coming back, and the cost, please? Now, just a general idea, doctor?
All right. Now, I'm concerned that this person has gone through and prepared her mindset for, for IVF. If that's the case, there are 2 steps. One is collecting the egg, collecting the sperm, and preparing the embryo. This takes only a max of 10 to 15 days. For the male partner, it only requires only 5 days, because you know, you need to study the sperm, the quality of the sperm, and then we collect the sperm. And for the women, we need to give her good therapy so that she releases a good quality egg. We take at least 3 to 5 eggs from a woman and then prepare the embryo. And then this is one process. The person flies back here. And then after 2 months of preparing her uterus with proper medication, because there is no point in preparing an embryo and putting in an unfavorable environment for the baby to grow. So the environment, the womb has to be prepared with proper medication, with the disciplined eating, no alcohol, and after the preparation of the womb, she flies back to get her embryo put in, and that process is another 15 days. And after, sorry to interrupt.
No, it's okay. Doctor, continue.
Can I? All right. After the process, she can rest for up to a week or so, because on the 18th day after the embryo transfer, we go for the analysis and check whether the embryo is perfectly fit in and there is no disturbance in the environment. She can fly home here.
Doctor, interesting question. In view that you create the embryo, it's all lab-based, of course, as we say. Can the person decide on the sex of the baby and how many babies we can go? In view that it is already a difficult process, can the person choose to have twins or triplets? We don't know. And can they decide on the sex of the baby? For example, if they're having twins, a girl and a boy, or 2 boys or 2 girls.
All right. This is a very complicated question, but it is a nice way she has put in. All right. Now, because the number of babies that are going to survive in the womb can never be decided by me or by anybody else. It all depends. We place 3 embryos inside normally. Normally, we put 3 embryos. All right. And if the womb is very cooperative, normally you have multiple pregnancies in a higher rate. The twins are very, very common. Otherwise, depending upon the womb status and her hormonal pattern, we decide what is needed at the time of insertion. We know what it is needed and what can be acceptable for the woman. So, we cannot challenge or decide upon, I need twins, I need triplets. It is all depending upon her uterus condition and upon the quality of the embryo and upon the quality of her hormonal pattern afterwards as well. So, it is not so easy as we put in, like I can have multiple pregnancies in one go. It is not like that, but still there are chances of multiple pregnancies very high with IVF.
So, all 3 eggs can fertilize?
Yes.
That is the best case scenario, or for some people the worst case scenario?
Yes. For me, I would prefer to say twins is accepted. Triplets, we are all doctors are on an alarm sign when it is a triplets.
Okay.
Because you know the huge hormonal shift the woman undergoes, the excess nutrition she has to consume.
Okay.
All three babies have to equally receive the nutrient, and no defect in all three babies, and the babies she needs to carry until 37 weeks or 36 weeks maximum. All these are the complications
Variables
afterward.
to the pros and cons.
Yeah, the
needs to be.
obstetric complications are
Yeah.
very high with triplets.
Okay. All right, mesdames et messieurs. This and we did mention about choosing the sex.
No,
You
because
can't.
the DNA of the embryo is decided later only, not before that. I cannot pick up an egg
And say, this is a boy.
no, because the sperm has both the
Yes.
X and the Y chromosome. Whatever the fusion happens,
Yes.
at the point, then it decides.
Ladies and gentlemen, we have to leave a little bit to nature as well,
Yes.
right? Yes, that's the
Allow
beauty of it, isn't it?
Yes, allow the miracle to happen on its own.
Yes, all right. We help it, but allow the process to take its course on its own. All right. Good morning. Nice having you here, doctor. Unfortunately, for a very short period, how will you follow up with your patients? Do you, when of course you have, as you said, the patient comes in for the treatment, and you mentioned you back here every end of the month on a regular basis. So there is a follow-up, isn't it?
Yes. To all my patients, I say, I come here every month,
Yes.
the last week of every month, and I'm just a WhatsApp away.
Okay.
I always reply on WhatsApp.
Yes.
And I am on a WhatsApp or tele-conversation with the patients
Yes.
when they want my opinion. And mostly it only takes 20 days because, you know, a woman, I see my patients have to have their periods every month. That is how the women, that is how the gynae or the obstetrics work.
Yes.
So I will be here every month at the last week, and after the last week when I leave, I'm just a call away in WhatsApp or in a WhatsApp message away and a teleconversation.
Exactly. Okay. So the technology has facilitated treatment so easy that you can talk to your doctor via the internet and make it easier, and
Yes.
she'll walk you through the process. It's the
Yes.
beauty of the internet.
Yes.
Doctor, I have an interesting question. Good morning, doctor. I have skin pigmentation. Can it be treated? Skin pigmentation, is it part of, can it be related to hormone imbalance as well, doctor?
Yes, very true.
Oh, okay.
Because of the androgen,
Yes.
that is the male hormone excess.
Yes.
The lady has got the excess skin pigmentation,
Okay.
and yes, it can be corrected, and by topical application of creams, that she can contact me if she wants the treatment. Apart from that, exposure to sunlight without a sunscreen, it is very dangerous because her skin is very sensitive to the UV rays. So she needs double protection for UV rays of A and UV rays of B as well. So a liberal sunscreen protection and a very high citrus fruits in her diet, like lemon, you know, like lemonade. It's all like that neutralizes the skin toxins, and plenty of water.
Yes.
3 liters per day. Apart from topical application of cream, this pattern will reverse her skin pigmentation.
Now, doctor, we have somebody asking about the PCOS discharge
Yes.
that comes with it. Can it be treated? Can it, if not fully treated, maybe in the process, how does it reduce? Can it be reduced?
The PCOS per se doesn't cause discharge.
Okay.
All right. This vaginal discharge, whatever the woman goes through, is mostly because of infection. The common things first, the later things last.
Yeah.
The PCOS is the last problem that will
Okay.
cause the discharge. The discharge is commonly because of hygiene or usage of public toilets without proper hygiene.
Yeah.
And you know, the partners, infection can extend from the partner and multiple partners. So the infection or the discharge depends upon the color, the texture, the smell.
Okay.
If the color is simple, because normal discharge happens when a woman ovulates and when a woman is pregnant as well. So this is considered to be somewhat jelly-like clear liquid that she is releasing.
There are some discharge that is supposed to be normal for
That
a
is
woman.
normal.
It's part of a process.
Yes, it's a part of a process.
Okay.
No alarm sign. Just don't use soap or shampoo in the private part to wash it.
Okay.
Because the pH is acidic, alkaline, no acidic pH will work.
Yes.
So you need to keep the wash or the washing the private area with simple warm water and nothing else. Sorry?
I have an interesting question. Can a woman be allergic or have allergic reaction to the sperm, the partner's sperm?
No.
Is this even possible?
No, never at all. I
Yes.
think the woman wants to know she's not becoming pregnant because of the sperm. That
Okay.
is what I understand. Because nobody can become allergic to sperm.
Yes.
Because I think she is releasing some antibodies against the sperm she is receiving.
Okay.
Yes, there is condition where the pregnancy doesn't happen
Okay.
because the woman is immune to the sperm antibodies.
Okay.
She cannot accept the sperm. So that is another condition. I think that is what she is. I can understand, but nobody can become allergic to sperm.
How often should a lady suffering from PCOS have their pap smear? How often should they be having their pap smear?
It is not to be related to PCOS at all.
Okay.
Every woman who is sexually active
Yes.
needs to have a smear test done every year.
Okay.
That is very, very important because it picks up the unusual cells or the abnormal cells at the earliest.
Yeah.
In 35 years, you can have it 2 years once if your smear is normal.
Yeah.
Above 40 years, every year if your smear is normal. And above 45 years, compulsorily it has to be done.
All right, doctor, I think we've covered the scope of today's conversation. And are there any last words you would like to share with the ladies? Put their mind at rest, and of course,
Ladies out there, take this very carefully because PCOS is very, very common and it is present in 60 to 80% of population.
Yes.
And not all PCOS are dangerous and it is not something cancerous and it can be treated by medical method and
Yes.
surgical method if needed, and the treatment begins from you cooperating with the gynae, starting with very disciplined eating and a
Yes.
healthy lifestyle, and avoid smoking and alcohol. And this is from Dr. Sunganya SARAVANAKUMAR from Sugan Hospitals, Chennai, requesting all women to have a healthy lifestyle and praying for all the miracles for all the couples out there.
thank you, doctor, for coming. It was an absolute pleasure having you this morning on the show.
Merci beaucoup.
Passez bonne journée.
Bonjour.
Et on this note, mesdames et messieurs, ça c'était, of course, Dr. Sunganya qui vient causer avec nous un petit peu le son différents services qui peuvent offrir. Et pareil, moi, tu dis, plus bonnet, ou capable de gagner contact avec lui. Et c'est un appointement important pour nous mettre un appointement, pour nous capables de voir le docteur. Of course, pareil, moi, dit, il y en a beaucoup de jeunes madame qui peuvent faire ça. Ça veut dire, le numéro pour call, 422, la voilà, 422 42 90, ou sinon, 252 14 90. Beaucoup de appointements pour la samedi, fait si qui ont un sens pour voir lui. Et pareil, il dit bon sens pour tout bon couple qui peut essayer gagner baba, mais aussi courage pour bonne madame qui peut souffrir avec sa bonne problème médical. Mais par contre, un petit alarme, un petit reminder par nous dit pour madame qui va encore faire besoin de pap smear, s'il vous plaît. Par le docteur dit il est important à 10 une fois par l'année pour nous faire ci, qui nous fait tout nos bons check-up, mais plus important nos pap smear à cause capable sauve nous la vie. Alors, le sanot, mesdames et messieurs, ça c'était le Topik Conversation pour aujourd'hui bon matin.